Hi, I'm Sandy and I want to talk to you about weight loss surgery. Now, before we start, I need to give you the disclaimer that I'm not a doctor. I've never played a doctor on TV. I've never been a doctor. I am totally unqualified to give you any kind of medical advice whatsoever. So, having said that, I'm just a person just like you who wants to get the surgery, and I've been doing research, and I want to tell you about some of the research that I've been doing and maybe also hold myself a little bit accountable. So there are two types of weight loss surgery. There's the lap band surgery and there's the gastric bypass surgery. Now, what is the difference, you're asking? The lap band, they take kind of like a balloon and they tie it around the opening to your stomach. They attach it to the opening of your stomach, and then they fill it with saline so that it restricts how much food you can eat at any given time. You can only eat about 2 ounces. The gastric bypass surgery, they actually cut out a part of your stomach and reroute the way the food goes. Both of them are extremely effective. Now, what's the difference? Well, if you need to lose weight really fast, maybe for a reversal of diabetes or something like that, the gastric bypass is probably a better way to go. If, on the other hand, you want maybe a slower weight loss, maybe you need help not just to lose the weight, but with the maintenance and keeping it off after, then the lap band might be more helpful. The reason is that the lap band can be refilled with the saline to restrict access more, or that it can be emptied. For instance, if you get pregnant or something and you need to be able to eat normal calories, and then it can be refilled when you finish. So it's a little bit more versatile that way. It's also reversible. They can take it out if you don't want it anymore. So I'm most interested in the lap band, so I'm going to talk more about that. So who can't get a lap band? Well, you'll have to excuse me. I'm going to have to put my glasses on to read this here. If you have the following conditions, you may not be eligible for the surgery: inflammatory disease, ulcers, severe esophagitis or Crohn's disease, severe heart or lung disease, or any condition that would make surgery risky, problems that could cause bleeding in the esophagus or stomach, portal hypertension, abnormal esophagus, stomach or intestine, or an intraoperative gastric injury, cirrhosis, chronic pancreatitis, or if you're pregnant. If you plan to become pregnant, like we already discussed, that's not a problem. Other conditions that might prevent you from being eligible: if you're addicted to drugs or alcohol, if you're under the age of 18, if you have an infection that could contaminate the surgical area, if you're on chronic long-term steroids, if you can't or won't follow the dietary rules or guidelines, and if you might be allergic to the materials and device, if you can't tolerate pain from an implanted device, or if you or someone in your family has autoimmune connective tissue disease. Honestly, I don't really know what all these things are, but I assume that if you fall into any of those groups, you would recognize yourself, and you already know that about yourself. But let's talk about what the process is to get the lap band. So basically, you start with a consultation with the surgeon, and then you may need to do some lab work and do a psych evaluation and a nutrition, talk to a dietitian. If you're trying to get it covered by your insurance, you may need to provide documentation of previous diets, that you've done medical diets, that you've done over-the-counter diets, that you have a history of being overweight, things like that. Now, something interesting. Just recently, in fact, December 2nd, 2010, or something like this, the FDA recommended to change the BMI, the required BMI to get the lap band surgery, from 40 with no comorbid factors to 35 with no comorbid factors, and from 35 with comorbid factors to only 30. Now, first of all, what are comorbid factors? Comorbid factors are diabetes, joint pain, sleep apnea, other problems that go hand in hand with the weight loss and that will go away if you can lose the weight. So now, what does this mean? It means that previously somebody that totally wouldn't qualify because maybe they were relatively healthy but had a BMI of, say, 37, can now qualify. So this is a new FDA change. So it's pretty exciting because it means that the surgery will be an option for far more people than it was before. So after you do all your consultations, then you may need to go on a pre-op diet to prepare your body for the surgery. Then you'll go through the surgery, and then you'll have some follow-ups after. At least this is basically what the process seems to be. Now, I've tried to put a lot of information into this tiny little video, so please look for other videos in the series, and that will give you more information. We're going to do one on the lap band diet. We're going to do one on the cost of the lap band and things like that. So just look for the title. Also, if you want more information, come on over to my website, San Diego Lap Band Blog. That's www.sandiegolapbandblog. And there you can get lots more information as well as a free white paper. Thanks a lot. I'll see you then.